I'm Dr. Ben Deheshi. I am an orthopedic surgeon and associate professor at McMaster University. I work at the Juravinski Hospital and Cancer Center, and I see patients with hip and knee arthritis, as well as patients with bone and soft tissue tumors. Osteoarthritis of the knee is a progressive degenerative condition associated with inflammation of the knee joint and gradual loss of cartilage, also affecting the tendons and ligaments around the knee joint, and leads to changes in the shape of the bone and bone spurs, all of which contribute to the pain and disability associated with osteoarthritis of the knee. There are a number of risk factors associated with osteoarthritis of the knee. At the individual level, weight gain or obesity, the age of the person. As individuals grow older, they start to gradually wear out their joints, as well as genetic components that may contribute. Osteoarthritis could also be associated with previous trauma, as well as mechanical malalignment of the knee or abnormal loading of the knee. The prevalence of knee osteoarthritis is about 20 to 30% of the population, as far as we know. There is probably a higher prevalence because not everybody with knee osteoarthritis is necessarily diagnosed early enough until they become symptomatic. As the population ages and the baby boomers getting older, we are seeing an increased prevalence of knee osteoarthritis, which will affect the healthcare system significantly. The clinical signs most commonly associated with knee osteoarthritis include joint pain, deformity with progressive osteoarthritis, swelling associated with inflammation, and impaired function. Radiographic signs of knee osteoarthritis include narrowing of the joint line, subchondral sclerosis, which is hardening of the bone under the joint, bone spurs or osteophytes, bone cysts, as well as malalignment of the joint observed on radiographs. Clinical symptoms don't always correlate with what we see on radiographs. There's a number of factors that can contribute to the patient's symptoms. We see patients that have significant pain and poor function with minimal changes on radiographs. Socioeconomic status may contribute to that, psychological stressors, job status, and all of those things can contribute to the patient's disability and have to be taken into consideration when you're assessing a patient with knee osteoarthritis. On the contrary, sometimes we see patients with very advanced changes on radiographs and minimal symptoms. Again, there may be different pain thresholds in different patients. I find that patients who tend to be older have better pain tolerance than middle-aged or younger patients. And again, other socioeconomic or psychological factors may contribute to the degree of symptoms. Osteoarthritis of the knee may be underdiagnosed. Patients who are not symptomatic may not necessarily seek medical attention and may not have any investigations to identify their osteoarthritis. Patients often present late when their symptoms are more severe or advanced for a variety of reasons. Pressures at work, not wanting to admit that they have an impairment or disability, as well as their fear of seeking medical attention or perceptions of doctors or specialists thinking that if they seek medical attention, they may need surgery. Treatment options for osteoarthritis of the knee range from medical management to physiotherapy, bracing, injections, and surgical management. Medical treatments include controlling the pain with medications such as acetaminophen, as well as anti-inflammatory medications. Physiotherapy can play a role in maintaining and improving function. Joint injections such as steroids and viscosupplementation can help with flare-ups and buy more time by controlling pain and function. And offloading braces can help offload the affected side of the joint. Surgical treatment options for osteoarthritis of the knee range from arthroscopic surgery and debridement, which only has a role with early osteoarthritis associated with meniscal tears or symptoms of locking and catching, but has a limited role with more advanced arthritis. Other treatment options to correct malalignment of the knee include osteotomies, and ultimately a partial replacement if there is only a single compartment involvement with other compartments preserved, or a full knee replacement.